welcome to the important session for Ovarian Cancer Awareness brought to you by Alma's Blessings. My name is Dr. Taya Burton, and it's been a minute since I posted any content due to focusing on my education. In the last 2 years, I completed my master's degree in healthcare administration and also my doctoral degree in also healthcare administration. Today, we are gathered to shine a light on a disease that often goes unnoticed until it's too late: ovarian cancer.
Disclaimer: this video has been developed for educational purposes only. The information presented is intended to provide general knowledge about ovarian cancer and its impact on women of color. It does it is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or heard in this video. The creator of the video does not endorse or make any representation regarding specific medical treatment or healthcare providers. And that being said, my history regarding ovarian cancer is due to my grandmother, Alma, being diagnosed with ovarian cancer, and due to her age, the physician decided not to provide medical care. I do believe that if we had located the disease in a early stage, there may have been a better outcome for my grandmother. Ovarian cancer is known to be the most lethal gynecological cancer and is known as the silent killer, which disproportionately affect African American women. Ovarian cancer is a type of cancer that originates in the ovaries, the female reproductive organ responsible for producing eggs and hormones. It can affect one or both ovaries and may spread to both parts of the body if not detected and treated early. There are three types of ovarian cancer. The first one is epithelial ovarian cancer, the most common type that originates in the thin layer of cells covering the surface of the ovaries. The second is germ cell tumors arising from the cell that produces eggs, less common than epithelial ovarian cancer. And the last is sex cord stroma tumors. It originates from the connective tissues of the ovary, which supports and nourishes the egg producing cells. Now, the question of the day is why ovarian cancer is known as the silent killer. The condition of ovarian cancer and its symptoms are bloating, abdominal pain, and frequent urination, which could be diagnosed as something else. But if you're frequently having these issues and concern, I suggest that you reach out to your physician and request lab work regarding all medical issues, especially if you have history of the diagnosis in your family. Like me, my grandmother had ovarian cancer. So it is imperative that you obtain yearly testing to ensure that you're able to catch the disease at a early stage to prevent it from spreading and affecting your body more. Ovarian cancer represents a significant health concern worldwide with its impact varying across different demographic groups, women of color, and partially face unique challenges related to ovarian cancer, influenced by factors such as socioeconomic status, healthcare access, and cultural barriers. Education about the disease is critical for improving outcomes and addressing disparities. Ovarian cancer incidence rates can vary among women of different racial and ethnic backgrounds. While overall incident rates may be lower among African American Hispanic compared to Caucasian women, those groups often experience different outcomes. The mortality rate with women of color, partially African American, and Hispanic women often have higher mortality rate associated with ovarian cancer. Research indicates that those disparities are partially due to the difference in stages of diagnosis and access to treatment. So it is important that you're able to locate that disease early to prevent the progression of the disease. So I encourage women at any age to obtain testing to ensure that you're able to locate any diseases to benefit you in the long run. Some of the factors contribute to the disparities of obtaining early diagnosis is limited access to healthcare services and preventative care can result in delay in diagnosis. Women of color may face barriers such as financial constraints, lack of health insurance, and inadequate access to healthcare facilities. There's also the cultural and social economic factors, including low income educational levels, can impact healthcare literature and delay in diagnosis. Cultural beliefs and practices may also influence health seeking behaviors and attitudes towards medical care. So it is imperative that we educate our community regarding ovarian cancer. I don't hear a lot of communities, organizations talking about ovarian cancer, especially in the Black and Brown community. It is important that we increase health literature among women of color, empowering them to make informed decisions about their health. Understand the importance of regular checkups and being proactive about symptoms can significantly impact outcomes. And educating them will help empower them and help women of color to navigate the healthcare system, including understanding their rights, access to financial assistance programs, and utilization community resources. Having early detection of ovarian cancer is imperative. Women of color may receive less aggressive treatment compared to our white counterparts. Disparities in treatment can stem from difference in healthcare providers' recommendation, patient preferences, and systematic bias. Disparities in treatment and late stage diagnosis contribute to low survival rates for women of color. Improving early detection and treatment options are essential to addressing these disparities. I keep reiterating that it's important that if you have any issues or concerns, that you be an advocate for yourself. Speak up, address your concerns. If you don't feel something is right, keep speaking up for yourself or have someone else to speak up for you. It is important that you express your concerns to your physician, and if your physician is not listening, you need to change medical providers. You're the consumer. You're paying your physician to give you adequate health care, and it is important that they are able to assist you in your outcome. The importance of ovarian cancer on women of color, especially black women, is underscored the need for targeting education and innovation to address disparities in incentives, diagnosis, and treatment. By increasing awareness, improving health literature, and fostering community support, we can work together in reducing the impact of ovarian cancer on our black women population and promote more equal health outcomes. Education is a powerful tool in bridging gaps in care and ensuring that all women have an opportunity to receive timely and effective treatment.
And lastly, give us a like and follow from Facebook and Instagram, and also subscribe to our YouTube channel, Alma's Blessing 3881. Thank you for watching and have a great day.